You've been faced with a lot of data, and what I want you to do is to use this time that we have together as information. I am not here to sell anything. I am here to inform you. I am deeply privileged to be here. Many of you are my patients. Hopefully those that are my patients are my friends. Thank you. But you are entitled to know the truth. And anything that I say, I want you to quiz, I want you to research, and I want you to verify that what I'm saying is in fact true. It was this picture that for the first half of the 20th century represented the way medicine was practiced. Taken by W. Eugene Smith in 1947 and published in Life magazine in 1948. It depicts the family physician making the house call. It's been said that there is very little of medical value contained within the black bag he carried. But the comforting hand of the physician, placed upon the forehead of a sick child, had curative power. We know that for the first 8 years of our lives, we don't learn by logic. Rather, we learn by emotion. Events occur within our lives that produce indelible imprints, and we use those for our decisions in the future. In our age group, most of us can remember a time when, as a child, a physician came to the home to care for us. And if there is one word that describes that time, one word that captures that emotion, it is the word trust. Our patients, our families, trusted the physician. No time in your life is that trust more important than when the word cancer arises. You don't know who, you don't know where, and you don't know when. But the most recent statistics would indicate that 1/2 of all males and 1/3 of all women in this country will be diagnosed with cancer in their lifetime. This creates tremendous vulnerability for each of us at a time when trust is so very important. You have raised excellent questions, and I would like to use this time so that we might gain information together concerning not only your specific questions, but also your health decisions. What is a Moffitt affiliation and what is a Moffitt partnership? We have a Moffitt affiliation at the Robert Boy Snow Oncology Institute. And what that allows us to do is to streamline referrals to this tertiary care center, get you in faster for evaluation. It also allows professionals from Moffitt to come to the local communities and give lectures. What has been included in a partnership, according to what was said on VNN, is actually part of an affiliation. But what we know is that the partnership appears to offer a branding of a name. In this case, our Moffitt Cancer Center. Let's look at the other parameters that need to be answered. The number of full-time Moffitt physicians in the villages. I know Dr. Craig Stevens personally. He is the chairman of radiation oncology at the Moffitt, and he confirmed to us as recently as last week that there will be one physician coming from the Moffitt. I have colleagues in the other specialties at Moffitt, and I have discussed that with them, medical oncology and the other departments. They either know nothing about what is occurring in the villages, and if they do, they have indicated that no one in their department will be coming. This is one paid employee from the Moffitt coming. Now, I have a difficult time calling it the Moffitt Cancer Center when in reality this is a contract between Central Florida Health Alliance and the Moffitt. And in order for us to compare the two, that is Robert Boy Snow Oncology Institute and Central Florida Health Alliance Moffitt, please bear with me if I temporarily remove the branding so that we can facilitate some realistic comparison between the two entities. Is that fair enough? We notice that according to this, it was stated that the medical service providers in this new center will work as a team as opposed to individual practitioners. But in reality, in both settings, Robert Boyce Oncology Institute and the Central Florida Health Alliance Moffitt, the diagnostic radiologists, the medical oncologists, and the surgeons are individual practitioners, and they overlap between the two entities. They are not employees of the hospital. They're not employees of Robert Boyce Oncology Institute, with the exception that the Moffitt employee is a radiation oncologist. The individual practitioners make recommendations based upon their years of formal training and professional experience. They are not limited to a participation with the Moffitt, but they also have the flexibility to affiliate with other institutions, as is planned with Mayo Clinic. Now, tumor conferences or tumor boards, where patients' diagnoses and treatment options are discussed in great detail, have existed for decades, and they are utilized regularly to discuss your particular case. What is proposed under a partnership is merely an expansion of something that is already utilized. Virtual conferencing, that is the internet conferencing, requires a camera, which can be purchased for less than $100, and a monthly internet service, and so for $150, you're up and running. And we are in the stages of creating such conferencing with Mayo Clinic. It did not require the duplication of $5 million of equipment to accomplish this internet connection. Let's talk about the equipment. I've broken down 3 machines, IX, Rapid Arc, and what you were told was TrueBeam. If, in fact, the treatment machine that is to be placed into the villages is a TrueBeam, then that machine differs from the price that you have been budgeted to pay. For example, the TrueBeam machine, as described to you as coming here, would cost $4.6 million. The statement was made that the facilities in Leesburg would mirror the villages, and I'm questioning, does that mean that now the hospital system is willing to spend $9.2 million buying 2 linear accelerators? It is true that serial number 0026 has been installed at the Moffitt in Tampa. But does that in fact mean that the machine you are getting is the same thing when you were budgeted for $2.5 million? It seems to me impossible that it would in fact be a TrueBeam. And I know the manufacturers of Varian, and they are not going to sell a $4.6 million machine for $2.5 million. The applicability of that machine would be hard to justify in this locale because the special features on that machine apply to less than 5% of the patients requiring radiation therapy. And that seems like a true waste of resources. That means that the equipment requested by Moffitt and pledged by the Central Florida Health Alliance is more closely price-wise to a Rapid Arc. And if it is in fact a Rapid Arc, that means that this will exactly duplicate what we already have at the Robert Boyce Oncology Institute. Now, the building for chemotherapy, and I am not a medical oncologist, but I certainly know after 35 years of medicine enough about medical oncology to tell you that when you get chemotherapy, as those of you who have, you do not get it every day unless you wear a fanny pack that's plugged in. You normally get it once a week, or once every other week, or once every 3rd week, or maybe just once a month. Radiation therapy is delivered each day, in some cases twice a day. Thus, there is no need to be in the same building, since chemotherapy and radiation therapy are not given together each and every day of treatment.